Thank you very much for that introduction, and I hope we are still awake. It's good that we have a bit of a stretch, and I'm the 10th speaker, so I hope you're not tired. But I'm here to give you different insight. I think we've been talking about the experiences in other countries, particularly in Europe, US, and UK. Here we go to the other side of the globe and see how it is different or how it is unique. So the topic assigned to me is on the government policies on nutrition, education, successes, challenges, and action. So I'll be giving a bit of not only nutrition education, but mostly the platform of nutrition in the Philippines, having been part of this planning and coming up with this particular program. So I'll be inspired and be talking about what is that forming? Oops. Oh, it's not moving.
No, the middle one. The middle one. Yeah,
Okay.
the middle one.
Yeah, thank you. So a bit of an introduction and give you the nutritional status of particularly children and provide you with a policy framework on the Philippine Plan of Action for Nutrition and some of the government policies in support of this framework and what are the nutrition and education activities in the Philippines participated by government agency and private sectors and give you the summary of this. So just to give you the location of the Philippines, we are located in Southeastern Asia. It's an archipelago composed of 3 major islands. But again, we have about 7,107 islands either during high tide, you can see this, but low tide, it's different. And part of the Western Pacific Arc system that is characterized by active volcano during that time, but we are characterized by typhoon now, since we have just experienced the super typhoon last week. So with this, we are in the Southeast Asia, bounded by China, Taiwan, and partly on the west, the Chinese Sea, Malaysia, and other areas in the Southeast Asia. Well, give you a bit of information about the Department of Science and Technology, where we are connected. It is a government agency that looks at the research and development in the country and to provide central direction, leadership, coordination, and scientific and technological efforts and ensure that result of therefrom are geared and utilized in areas of maximum economic and social benefit for the people. So I highlighted the last portion of maximum economic and social benefit for the people. So how we will work on this? I think we've been talking about this topic since yesterday. And to achieve this, the department formulated this framework. We do the R&D, and the result of R&D should result to 6 Ps. Earlier today, we have 4 Ps, and our 4 Ps is our measure of performance is through coming up with the product, partnership, patent, publications, programs, and policy. So I highlighted the policy because that's part of my discussion today. And of course, out of these research results, the 6 Ps, it should turn out to have an action and eventually measure the impact of these programs. So at the department, this is our organizational structure. We have the secretary, which is equivalent to a minister, and we have different undersecretaries who help the secretaries in day-to-day activities. And with this, we have the Research and Development Institute, RDIs, which is responsible for generating research in different areas, like, for example, the advanced science technology, the metal industry, the MIRDC, the Philippine Nuclear Research Institute, the Philippine Textile Research Institute, or the PTRI, and the Forest Product Research Institute. And of course, we have the bold line, which is the Food and Nutrition Research Institute, or the FNRI. We have the council that really monitors the performance of the different R&D and provide funds for research in different sectors. We have advisory bodies, the National Academy of Science, which provides advice to the Philippine government, and several research institutes. Our agency is down to the regional level, where we have the different offices promoting science and technology. So we've been talking about, this is the FNRI. So you'll notice that as an advocate, we translated the building to a, what you call, urban garden, just to demonstrate that the value of nutrition is through this particular system. So this is, again, a part of our advocacy in the consumption of vegetable, which I'm going to talk to you later. So with this, our vision is to come up with optimum nutrition for Filipinos, socially, economically empowered through scientifically sound and globally competitive technologies. So our mission is, as the lead agency in food and nutrition research and development, the FNRI fights malnutrition, not with food, but with accurate data, correct information, and innovative technologies. So we are mandated as our legal basis to undertake research, particularly identify the nutritional situation of the country. What are these causes and effects, and identify solution to this problem. We also develop and recommend policy options, strategies, programs that will address the malnutrition situation of the country. And finally, it should be diffused or transfer these technologies to the relevant end users, either the government, the different stakeholders, and private sectors. So our first mandate is to conduct the nutritional assessment of the population. So this is a big mandate of the Institute that really identifies the nutrition situation of the different age group. And it has as I mentioned, it has a legal basis that we do this, and it becomes the critical data for decision-making of the government and private sectors. So we've been doing this since 1978, and our last data generated was in 2015. And you'll note that we do this in between to come up with updating data. But generally, it is done every 5 years, and in 2018, we are doing it annually. So I will report to you the picture of 2015 data. So if you look at the sampling design, it is based on a nationally representative sample covering the 17 regions of the country, 80 provinces, and it's based on the 4 replicates of the master sample. So you'll note that it's a multi-stage design coming up from the different villages, and the ultimate and the third stage is the household, where it is it's covered by all members of the household. So in the last survey, we covered about 200,000 individuals as our respondents of all age groups. So what are the components of this? First, we call it ABCDE survey, or simply, we have the anthropometric, biochemical, clinical, and health. The dietary assessment, which is composed of 2 methods. We have the household dietary intake, which is the food weighing, and the individual level, where we look at the intake of different members of the household. And of course, with the infant and young child feeding and maternal nutrition. We look at the socioeconomic condition also of our respondent, and how the household and individuals respond to the government program. So I'll be talking about children because that's what is being asked in this presentation. And it's a good news or bad news. But over the years, in 2003 up to 2015, although it's decreasing in a very slow pace, we see that it's about 3 out of 10 children are still underweight and or stunted. And there seems to be a increasing prevalence of overweight and obese children. In a big picture, if we look at the disaggregation of data, we see that all in terms of underweight, we can see that more on the lowest income quintile, both in rural and in urban. And we see that this is the other side, in terms of stunting, we see again the picture that is more on the poorest member of the population. At least you can see that in the urban center. On the other side, we see the prevalence among these children in terms of overweight and obesity. We can see that higher proportion, even in the rural or urban center, it is with the rich people that the prevalence of overweight is quite high. Now, looking at the big pictures, you see that over time, if we plot it from 0 to 10 years old, you see that at the age of 6 months, we see a big increase in terms of stunting, and it tapered a bit once they are at 5 years, and it becomes so high that 3 in every 10 children are found to be either underweight or stunting. So this is something that we need to focus in terms of the nutrition intervention of the country. So it is not changed over time, even for when they reach 19 years old. Well, it's not all bad news. We see that there is a declining proportion of the population in terms of anemia, and from a public health figure, we now stand at 11%. Similarly, when disaggregated according to the income quintile, we'll see that, again, the poorest has a higher prevalence compared with the rich respondent. Well, in terms of iodine deficiency, we see that it's a good news. We have not much a problem, particularly for children, but we see the higher proportion of urinary iodine excretion among elderly, lactating, and pregnant women. So with this, it is important that what are the food that they eat. And based on our survey, the mean one-day total food intake by population group is represented here. And for children, it's about 580 grams per day, the 6 to 12 years old children. And what are the food that they eat? It's mostly cereals and cereal product, meat and poultry, and fish. This age group also consume a bit of milk, but less of other food products. It's about 5% of this population group consume vegetable and or fruits, and a little bit higher for vegetable. So we look at also the fluid intake, which is composed of all the fluids. And generally, we found the population has low fluid intake across the population group. And it's about 17% of the population meets the recommended water intake for this group, or fluid intake. So the next question is, what are the contribution of the food that this particular age group contribute? In this case, contribution to energy. So we see that they are mostly coming from cereals, generally of all age group, and it's about 71%. And in terms of meeting the recommended energy requirement, it's about 20% of the population. So we need to understand also the protein intake, and it is generally contributed by cereals because we consume about 200 grams of cereals per day, and it's composed of the higher proportion of the protein, and to include protein coming from fish and fish product, and some of these meat and meat products, the red one. And on the average, we have about 41 grams intake of protein. Iron is a bit also meet only by about 20% of the population for children 6 to 12 years old. And this is generally contributed again coming from cereals and cereal products. A little bit of contribution coming from fish and meat and poultry. In terms of vitamin A, generally, again, coming from fish, meat, and poultry, and for all population group. And it's only about 34% of the population of this particular age group meeting the AAR for this particular nutrient. So understanding, of course, we have the carbohydrates, and generally, all age group will come from cereals and cereal products. We eat rice at least 5 times a day. So with this prevalences intake, we need to understand the economic consequences, and we look at the burden of this particular nutrition situation. So in 2013, in partnership with Save the Children, we conducted the study looking at the effect of the child undernutrition, and we noted that we lost about $7 billion per year just because of the undernutrition. And in particular, due to stunting-related grade level repetition of school children, we lost about 25 million US dollars in 2013. This is due to the, when the child gets sick, when the child repeat their schooling, it costs us so much that it's equivalent to 25 million. So to further understand this, we look at the economic burden of undernutrition, and a study with the University Department of Health and UNICEF, using our national nutrition data, we have noted that the poor path of measuring economic losses will be due to the pathway number 4, which is due to the iodine deficiency, anemia, and child stunting. And this lost the future productivity of a child, then child cognitive performance and growth defects. And we estimated this is about 3.1 billion per year as an economic loss. So stunting particularly affect the school performance based on this report. And of course, the deficiency in terms of the micronutrient, anemia, iodine, accounts for the greatest loss of $3 billion per year. So these are the sum of the disaggregation coming as contributed by the deficiency, and the highest you can see is the stunting problem, which is about more than 50% of economic loss. So there are certain, we need to have the intervention. We need to look at the cost of cost of this type of undernutrition and the benefit that can be derived if we invest in this type of intervention. And we have learned that for every $1, we can gain a benefit of $12. This is the future expenditures in the period of 10 years. So we see that the proposed intervention, which is something to address with proper complementary food fortification, may have significant effect in terms of the delivery, in terms of improving the nutrition situation of the country. So with this, we come up with this policy framework on nutrition. And this is part of what we call now the Philippine Plan of Action for Nutrition, or the PPAN 2017 and 2020. So just give you a bit of background about the Philippine Plan of Action. This is composed of different departments of the government, which is the Department of Health, local government, social services, the science and technology. We have also the budget and management, trade, labor, and of course, we have the representative from private sectors who formulates this particular policy on nutrition. And the secretariat is what we call the National Nutrition Council. So it's been there since 1974, and the last one is in 2016. So historically, what are the breakthrough over that period of time. And what led to the Philippine Plan of Action of Nutrition in 2017 and 2020 as a policy framework of nutrition program in the country. So if we look at the program component over the years, you see that nutrition information and education has been part of this program, together with the food fortification, micronutrient services, and food production, among others, and other support program, particularly on family planning, maternal health, etc. We see that there's an improvement over time, but not much. Over the time, when we started in 1989, as you see, that in terms of stunting, we are still at the 33%. So seems that we need to do more. Although it's decreasing, we need to do more in terms of scaling up the nutrition program, particularly for children. And this is the 5 to 10, so it's got to have the same profile in terms of the situation of underweight, stunting, wasting, overweight, and obesity. So what are the successes that we found over the time? Well, undernutrition among children also decreased. Micronutrient deficiency, particularly iodine, anemia, and vitamin A deficiency, which I did not present to you, generally decline and come up with a good proportion of population that are not being affected. Hunger prevalence among households has been noted to decrease, and we have increasing breastfeeding practices. Well, we have the challenges. As you see in the data, stunting among children is quite a challenge. Overweight and obesity among children and adults is something that we need to look at, which resulted to the high proportion of population, particularly adults, having the non-communicable diseases, hypertensive, and diabetics, among others. And it's still a challenge among our pregnant and lactating women. So with this, we need to focus on, look at the gap as the formation of the policy. We need to look at the common understanding of existing laws and policy. There appear to be a different interpretation from the top to bottom. And of course, like any other programs, manpower and human resource development is always a gap in terms of reaching out the number of people. And it appears that the Philippine Plan of Action member agencies has different interpretations and disconnect between agencies to reflect an impact on nutritional status of population. And of course, there's some limitation in terms of participation of private sector in nutrition program. So we have this formulation process, look at the evidence, come up with what program that works, what are the programs that did not work and became a challenge. So we have the desk review, focus group discussion, consultation, among others. So we arrive at this framework leading to the sustainable development commitment of the country and focusing on very specific areas like pregnant women, the low birth weight, the breastfeeding rate, the complementary food, because at the age of 6 months, you see that there is significant increase or steep increase in the proportion of stunted children up to 3 years, and it did not change over time. So we thought that we need to look at the appropriate, age-appropriate complementary food and maybe improve the food intake. So we have the nutrition-specific programs and nutrition-sensitive programs as supportive programs, particularly in crafting policy, and some of the enabling programs in this policy framework. So, as I mentioned, we have the child stunting. Although the deficiency in terms of iron and iodine, we need to maintain the decrease, but this included because there are some pockets of populations that are still, we have a big challenge, particularly for pregnant and lactating women in terms of iron and iodine deficiency and vitamin A deficiency. And again, overweight and obesity and poor infant and young child feeding. Okay. So we have the strategic trust as part of the PPAN and focusing on the first 1,000 days and implement a nutrition-specific and nutrition-sensitive programs. And as characterized, we need to intensify programs down to the local government units where the action should be. And we identified that geographically isolated disadvantaged area, or we call GIDA, and communities of indigenous people. I've shown you in the map that we are scattered, we have several islands, and based on the study, they are hardly reached by intervention and assistance by either government and a private sector. And there must be a complementation of action at the national and local government. So, like any other plan, plan, we have targets, and this is subscribing to the global targets of maternal and infant and young child feeding. So we have a lot of targets, and I will go quickly on this, just to demonstrate that we need to meet our commitment in terms of reducing the prevalence of stunted children and wasted children. So, in terms of vitamin A deficiency, we hope at the end of 2012, we are less than 15%, and anemia will be about 6%, or completely eliminated. And again, this is something in micronutrient deficiency. And in terms of overweight, we need to address this, as we see that among children, once they get old, they will have these non-communicable diseases soon. So, as I said, we need to focus, and we identified in the plan and in the policy priority provinces in the country that has been shown to have high prevalence of stunting and other nutrition indicators. So we have 31 and about 38 provinces scattered all over the country. That means that we will focus our intervention in these provinces. So, in terms of behavior change and nutrition education, we have these nutrition-specific programs, particularly in school, communities, workplace, and there are designated government departments and development partners to be part of this behavior change program. So, we have also the nutrition sensitive, which we tweak accordingly, such that they will answer to certain nutrition problem and result to outcome. And one example of this is the school gardening that we promote and the corporate gardening. So we have enabling mechanism. We'll talk mostly about in the local government unit, where we see that the action should be, compared with the previous plan, that it is something that we need to look at. So we have the implementation mechanism from the national down to regional and the local government sector. So we have this launch and now promulgated as the blueprint of the Philippine Development Plan. So what are the government policies in support of the plan? We have the Department of Education, who really looks at the children. So we have the Bureau of Learners Support Services that formulates the national framework for this, particularly school health, youth formation, and sports in school. So the school feeding program has been promulgated, and of course, the Gulayan sa Paaralan and nutrition education is part of this particular policy of the Department of Education. I won't deal much on that, but simply saying that the policy promulgated by different departments is in congruence with the National Plan of Action for Nutrition. So these are some, and nutrition sensitive, particularly nutrition promotion and continuous health and education in the formal setting, is part of the nutrition sensitive school nutrition program. So, yep. So, other policy has been promulgated, particularly in the feeding program. What I want to discuss more is in terms of some unique program that can be shared This one is the policy on school feeding program. Last month, the president has signed this, mandating and providing funds for the school feeding program, together with the mandated nutrition education among school-age children. And this is the promotion in terms of this Republic Act 11037, combat malnutrition and hunger among Filipino children. What I want to share with you is the policy of the Department of Education, which is a color-coded system, wherein the green category prescribe that this food item should be always present in the school canteen. Whereas the yellow category, these are food that must be present in the school canteen every Tuesday and Thursday. And of course, the red one, which is high level of fat, sugar, and salt, is strictly prohibited in the school canteen. So this is being implemented, and to support this, we have also city ordinances that supports the policy, particularly when the children are out of school in the community. So prohibit the selling of this particular food. What about the nutrition education? It's not really new, as mentioned. It's been part, and we have this strategy among our media practitioner. We call it NutriComNet, where we talk to media and tell them the good news and not the very good news, such that they will be our partners in promoting nutrition. So we have the radio program. As part of community nutrition, we have the DOS Pinoy program, which prescribe the complementary food among children. So we have this package of intervention, particularly for improvement of the children. And we focus on the supply, which we set up production facilities in the areas, and of course, the demand strategy through the local government unit to purchase and provide feeding program using different modules. We call this MRP, and we have nutrition education for mothers and caregivers during the 120 feeding days. So we are everywhere in the country, and we have this, again, Pinggang Pinoy, which is a food plate, healthy food plate for Filipino adults. And we come up with recommendation for different age group. I'll be sharing with you some of these materials. We have limited time. But recommendation for kids, teens, adults, and elderly, wherein the recommended proportion is being given. So the GO food are the energy giving, and the GROW food are the body building. And of course, the GLOW is the body regulating food. You have the choices. And of course, coupled with water. I think water is something that has been missed, as you can see in our data. So together with this, we campaign for appropriate reading and stay physically active. So just give me 1 or 2 minutes. So this is just sample of the plan that will give you a 2,000 calorie per day. And it's a complementation of our food pyramid. Now, what are the creative partnerships over the years with nutrition education, particularly with the private sector? I think this is something that's missing in the previous plan. Of course, we partner with agencies like Unilever, as we've been sharing this nutrition campaign, particularly in coming up with a calendar. Our studies show that calendar is a good way to communicate appropriate food intake or feeding. So we come up with a 21-day cycle menu. And this is thematic among elderly, children, and some of the adolescents. Over the years, we've been issuing this as a guide to homemakers and other program implementers. We have low consumption of vegetables, so we campaign through our movie personalities and children. Of course, mabuhay ang buhay, makulay ang buhay sa sinabang gulay is something that campaign for the consumption of vegetable particularly among children. We have also program on the micronutrient, which is being given during the feeding program of this company. Well, this is a unique partnership with Robinson on educating and empowering customers to live healthy through the following. Again, the calendar. And what is unique in here is that the green shelf tag. Through our partnership, we classify the products submitted by the company as green, which is meeting at least 3 categories based on Codex guidelines. And yellow, if they are on special sale. Orange, when they are having special discount. I think orange and white for the regular food item. So this classified when they are low calorie, low fat, etc. And you can see this in the supermarket where the consumer and buyer has been guided with this particular campaign. And of course, we have partnership with Nestle, and we see that we unite in bringing nutrition affordable, enjoyable, and virtually accessible to everyone. One unique partnership is in terms of addressing micronutrient deficiency. So we assisted the company in terms of the level of micronutrient to be added. And this is what we call advocacy in terms of the micronutrient deficiency in the country. We conducted an efficacy study also on the product. And to do that, we have several campaigns. We call it Laki sa Gatas, to promote the consumption of milk through nutrition education in school and community. We have also the Healthy Kids program, which is something that look at the physical activity among Filipino school children, which is called the Healthy Kids. And recently, we have the United for Healthy Kids, or U4HK, which is a campaign for proper nutrition among children. And this is in partnership with our media partners. One unique thing that we have is the nutritionschool.ph. This is a school where up to now we have about 2 million hits and about 6,000 graduates who enrolled in this particular nutritionschool.ph, where we have different modules, review schools, and there's an examination where you can, if you pass the exam, for 6 levels, you'll be given a certificate. And I understand the company used this in employing some of their, some staff that are deployed in some of the supermarkets. So Coca-Cola is not really bad. We look at improving the drink, the NutriJuice drink, by adding certain micronutrients. Of course, we look at the sugar content, and we conducted an efficacy study and showed that there's an improvement in terms of the anemia prevalence among school children. Efficacy and effectiveness has been found to be very, very good. PepsiCo, on the other side, we look at the oat drink of the formulated, and we see there's an improvement in terms of the level of serum vitamin A, zinc, and etc. Well, lastly, we have this McDonald's, and in terms of nutrition education, we developed a big book that has been used in teaching the student or the children in terms of the value of the Go food. And finally, the Goldilocks, which is one of the local food chains. So they are our partner in terms of campaign for the Pinggang Pinoy, the Filipino food plate. This is a chain of restaurants in the Philippines that support our program on balanced diet. So initially, they thought that we have only the Pinggang Pinoy one, or the Healthy Plate one, composed of vegetable, fish, and fruits and water. But since there's an increase in terms of sales, we have now 3 variants of the Pinggang Pinoy. So these are some of our initiative in terms of the partnership with the private sector. So in summary, we learned that eliminating hunger and malnutrition is technically feasible from research, policy, and action. The challenge lies in generating the requisite political will, developing realistic policies, and taking concerted action nationally and internationally. And finally, The development and implementation of effective nutrition policies by government have been hindered in the past by several factors, including insufficient knowledge and capacity. And we are trying to address this through the different media and platforms. So action and advocacy by many stakeholders are needed to overcome these barriers. So private sector has a very important role in addressing malnutrition in the country. So with this, maraming salamat po, and that's the end of my presentation.